Hi, I'm Dr. Ray Middleton, a systemic practitioner in family therapy and an independent trainer. In this training, I'm going to share knowledge and skills around how to take a trauma-informed approach when working with people with more complex needs.
By complex needs, we mean people with combinations of needs around their mental health, combined with alcohol or drug use, and homelessness or accommodation needs, and employment support needs, often combined with other needs.
I'm someone who has personally experienced childhood trauma and found ways to recover. So I have some lived experience of using mental health services in the 1990s, including sometimes being an inpatient in the psychiatric hospital and attracting various diagnoses before I got better. It's important to know people can and do recover from trauma, as this inspires hope. On my recovery journey, I did a PhD looking at the impact of trauma and recovery, and I've helped a number of organisations write and deliver trauma-informed training, including our local mental health trust. In addition to managing a personality disorder service, my previous jobs include being a housing support worker, being a care coordinator in an early intervention in psychosis service, and being the workforce development lead at Fulfilling Lives. Talking about trauma can sometimes trigger or stir up uncomfortable thoughts and emotions for people. However, it's important to learn about common reactions to trauma in order to better support people with complex needs. If you're building a helping relationship with people with these needs around mental health and substance misuse or accommodation needs, more complex needs, then you are working with people with higher than average levels of past trauma, combined with current adversity that they're facing, so it would make sense to get some trauma-informed training. Being trauma-informed is not about being a trauma-specific therapist. It's about learning some general knowledge about the effects trauma can have on people and learning some skills that can help people, such as being validating, building people's motivation, and working collaboratively with people in co-productive ways, sharing power that sees their strengths and potential to develop. To help everyone feel safe exploring the topic, there is no expectation for anyone to share personal experience of past traumas in response to this training. If you wish to share personal experience, that's absolutely fine, and it's also okay not to disclose personal experiences of trauma. The choice is yours. This is an important value in trauma-informed approaches, to give people more power and control by giving them more choices. If the topics discussed do trigger or stir up difficult thoughts and emotions, please feel free to take some time out of the training at any time and make use of the normal ways in which you cope when feeling unsettled, such as talking with someone you trust. If you want to read and learn more about this topic, two publications I would recommend reading are The Last Frontier from the Blue Knot Foundation and Trauma-Informed Care in Behavioural Health Services, or TIC 57, from SAMHSA, the Substance Abuse and Mental Health Services Administration. I draw on and reference both of these publications throughout this training.